This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client Jackson flew in from where?
Philadelphia.
Philadelphia, okay. And he has had 2 hip surgeries for femoral acetabular impingement and a labral tear, and is doing rather well with both hips. His range of motion is really good. Has a little bit of discomfort in the proximal adductor on the right, and then a little bit of lateral hip pain. The main reason he came to see me is for pain in the region of his sacroiliac. And on the pain drawing, he draws, lines across the SI area, extending laterally to each upper buttock. I find that his lower pube on the left is posterior. So that is a posterior rotation of the left pubic joint. And of course, there's only one hemipelvis, so we know there's abnormal movement in his left SI joint. The pubic bones are symmetrical at the top. They're symmetrical on the tubercles, the upper third, and then the middle third is symmetrical, but only when I come down to the lower third do I have asymmetry, in which the left side is posterior. This is part of a pattern that I've discovered, including that finding. I found that there's no such thing as a posterior pubic rotation. There's only an anterior rotation. And with this pattern, the ischium is posterior per palpation. And of course, if the pubic rotates posteriorly, the ischium is also going to rotate. The sit bone, the ischium, is also going to rotate posterior. And that's going to put excessive tension, especially on the sacrospinous ligament that attaches from the inferolateral angle of the sacrum, of this little shelf, and it attaches to this point called the spine of the ischium, and that ligament will be quite tight. I would expect that the sacrotubus would be tighter. I palpated that ligament. I was not able to tell that there was any difference. But what accompanies this pattern, that I call a lower windswept pelvis, it's not a fracture pattern. There is in the orthopedic literature a lower windswept pelvis, and that's a fracture pattern. This is not. This is a positional asymmetry in which the upper parts of the pube and the sacroiliac and the ilium, sacrum, are symmetrical, or at least by palpation, by observation, they look symmetrical. If there's an asymmetry, it's too subtle for my eyes, but there's a distinct asymmetry in the lower pelvis in which the left ischium is more lateral in relationship to the gluteal crease, the midline crease of the buttock. Right ischium is closer and left ischium is posterior. There's also a rotational element that happens with this pattern. We did find a slight asymmetry of his hip rotation, and we'll look at that again after we treat this. I don't know if we're going to change that or not. I fear my camera angle didn't capture everything I said. So let me go over that one more time.
Okay.
All right? So to repeat, a lower windswept pattern, which I have described, I discovered that years ago, includes a posterior rotation of the lower pubic bone. Okay? So the lower third is posterior. That moves the ischium part of the sit bone posterior, creates increased tension on the ligament that connects from the lower sacrum to the ischial spine, called the sacrospinous ligament. As part of this pattern, the upper landmarks of the pelvis in the front and in the back are symmetrical. If there's a difference, it's too subtle for me to see with my eyes. But the lower is very obvious, as you'll see on him, in which the left ischium, the left sit bone, this is his pelvis as though the person was laying on their stomach. The left ischium is lateral, the right ischium is medial, okay? And there also is a rotational, transverse plane rotational pattern to this presentation. Along with that, the coccyx is slightly side bent to the left, and this little projection, lateral projection, is called the transverse process, and it is when the tip is side bent off to the left, then the transverse process goes up. So therefore there's a deeper space palpating it in comparison to the right side. And you'll see that. The other thing that he presents with, interestingly, is that he has normal spring when I backward bend the sacrum. Okay? He has normal inferior glide spring of the sacrum, normal spring throughout each ilium. Okay? He does not spring forward at the top of the sacrum, and he does not spring at L5. And I'll demonstrate that. He also, of course, lacks spring on the sit bone medially on the left, laterally on the right, but he also lacks medial spring on the right and lateral spring on the left. So these are at end range. I do suspect that I can improve the symmetry somewhat, but that there will still be an asymmetry of both sides, just based on experience that I have. I think that he has a developmental asymmetry as part of that pattern, and that translates to how he sits. And there are some things we can do to modify the sitting surface to accommodate pelvic asymmetry. We'll cover that as well. So let's demonstrate on Jackson what I just showed you on the pelvis. So coming down from the abdomen, we come to the pubic bones, and they are symmetrical at the top. Top front is equal, middle of the front is equal, and when we get to the lower part, I'm not sure if the camera can see this or not, but my right thumb is distinctly forward, and it would cross over the left thumbnail by 3/16 up to 1/4 of an inch. Okay? I could do a spring test on that lower pube. Okay, I feel a little give when I spring. Do you feel that little tiny bit of give? Okay? And then when I spring on the right, it's distinctly less.
Yeah.
Okay? So it has a propensity to go further in that direction where it is already. Okay? It's not stuck at end range. All right? Lie on your stomach, please. So when I come on the flat part of his left ischium, the sit bone, the back of the sit bone, I'm trying to take up the slack, I'm trying to spring it, and there's no movement. When I do the same test on the right, I can take up the slack, I see the leg move, and I can feel it move a little bit, and then it stops. And then I can thrust it, and it thrusts forward, but it bounces right back with integrity. Okay, we have blocked motion here. The midline crease of his buttock is the same as the crease in his clothing. Okay, and this right ischium is about 2 thumb widths away from midline. The left ischium is more lateral. It's about 2.5 thumb widths lateral or more. The left ischium does not spring medially. The right ischium does not spring laterally. Same thing, they don't spring medially on the right or laterally on the left because they are at end range. The tailbone, there's a deeper sulcus with my right index finger. It's higher towards his ear by about 1/4 of an inch. And if I hook my thumb on the left side of the tailbone, okay, I'm going to spring it now. There's a little bit of give. Okay, I'm going to come over, and that's surprising because usually that give is absent. So I'm going to spring it on this side, and there's a little tiny bit of give. Do you feel that?
Mm-hmm.
The motion translates through that structure into the rest of his pelvis. Now, because I have spring mobility on going to the left, don't go to the right, from the left to the right, then I think it's just soft tissues pulling it a little bit. I don't think it's at end range of side bending. Okay? Usually it's blocked when I spring it that way, but when I find an anomalous finding, it just shows me that I'm paying attention. I'm not, predicting what I'm going to see and then going and seeing that. I'm actually seeing what your body is actually doing. The sacrum has good inferior glide spring. I see his feet bobbing up and down. Okay? He has backward bending spring mobility. Then I find the PSISs. I'm at the very top of the PSISs, and that puts me at S2 of the sacrum. So the heel of my hand is just above that, and I'm on the sacral base, which is actually the top of it because it's like an upside down triangle. That's at the level of S1, and I can't load it, and I'm trying to spring it, and there's no spring mobility. And then I come on to L5, and there's no spring mobility at L5, and then I come up to 4, and now we have a little bit of spring. And that continues up his body. Okay? Now, for this asymmetry of the pelvis, he compensates up high at the occipito-atlantal joint, where the occiput joins the first cervical vertebrae. And that's just a muscular reflex, and that pattern is a right side bending fixation, a muscular fixation. When I palpate his mastoid, which is part of the temple bone, or don't quote me on that. Let's just scratch that. When I'm under the mastoid, if I try and spring it this way, it doesn't move. And it's visually lower on the right. Okay? He does spring in rotation on both sides, and he does spring obliquely on both sides, but he doesn't spring up on the right. But on the left mastoid, he does spring up, okay? And that's just the body's reflex at work. And that is going to self-correct, reflexively release when we restore normal movement in the pelvis. So my goal is to improve motion in your lower pelvis. I don't think I'm going to make it symmetrical. I think you're designed asymmetrically. But, excuse me, it might improve your hip rotation. That remains to be seen. I do have another YouTube video on self-treatment for a lower windswept pelvis, so I'm not going to cover technique in this video, but we'll come back and we'll film your response to treatment. But you can just search for lower windswept pelvis on YouTube, and then my last name Hesch, and then treatment, and you'll see how treatment is performed, and you'll be able to see self-treatment for it as well.